Hello, this is Billy Rand with Healthcare Optimization Partners. I'm the Vice President of Technology and Analytics, and I'm excited to introduce to you all Labor Insights. Through our years of experience in the healthcare industry, we always encountered a recurring theme when it pertained to workforce management. Healthcare organizations were becoming more and more data rich, but information poor. Thus, why we created Labor Insights. Labor Insights takes in the many different complex data systems and then converts the data into strategic, meaningful information for all levels of end users, which allows them to make better informed business decisions. I will be briefly demonstrating each section of Labor Insights. Keep in mind this is just an introduction. If you have more questions or would like a live demo, please contact us at our website, hcopt.com. The first section of Labor Insights I want to introduce is called Leadership Dashboard. This is a roll-up of every department into directors, senior leaders, and facilities. If I click on Medical City as an example, and then drill into the senior leaders that report up to that facility, let's say Andrew Jackson, it's going to now list the directors that roll up to Andrew Jackson. Now I can select any director that I choose here, and then the list of departments will be shown underneath these directors. So once I select this director, we'll see all of the departments now that roll up to the director selected. The next section is the productivity report. This lists every department within a health system that's in scope. Each department is associated with a facility, a senior leader, and a director for grouping and filtering purposes. As an example, if I go under the facility filter and I select Medical City, all departments associated with Medical City will be shown. Now, if a director was using this tool, they would simply click on the director's filter and start searching for their name. They would select their name, then all the departments associated with their name will be shown. This is a great example of how end users can filter data using the associative data model. The next section is called Department Analytics. This gives a more visual sense for an individual department that the end user can use to see what's going on within their department. There's the position breakdown, which lists the skill mix. The next section is the pay type, which shows the pay codes associated with the FTEs. And the next section is the productivity versus target, which shows what the current productivity is compared to the target. And then lastly, the FTEs versus unit of service. This shows the trend of the volume compared to the staff worked. Labor Insights automatically has time analysis, so users are able to see their data from a year perspective and be able to use with their mouse a zoom in feature to go from a month, a week, to a day to see how they're performing. The next section is the charge detail. This is where individuals can see what charges are associated with their productive volume for each department. This gives full transparency on what charges and what weights are associated with their volume. Along with the charge detail table at the bottom, there's a line chart that lists the unit of service by day. An individual can select a date or a date range to dynamically filter their data selection. The last section I want to introduce is KPI trends. To see the KPI trends, an individual will select a single department. And when doing so, the list of KPIs will be seen above in blue. KPIs that are an area of concern are colored red. KPIs can be custom tailored to the partner's needs, but here is an example of a few. To see a trend of a KPI, just select the value on the y-axis and choose which KPI you'd like to see. A line trend will be shown. Here you see we've gone through many different KPIs to see the trends. This wraps up our Labor Insights introduction. Please visit our technology page to test drive Labor Insights yourself. Or if you'd like to request a live demonstration or have additional questions, please visit our contact page at our website, hcopt.com. Thank you.